Today, we will be focused on the application of nuclear radiation in medicine. Okay? So the application, we are going to find out how nuclear radiation is being used or applied in medicine. And then after that is the application of nuclear radiation in medicine, good or bad in living things and in the environment. And what is the importance of why radiation safety is important. Okay, so what do you think what will be our activity today? Why these chairs are arranged in this way? Do you have any idea about the activity that you are going to perform today? Yes. And what is that? Elaine, what do you say?
I think we are going to have a debate regarding to that lesson.
Okay, correct. Very good. So we will have a debate. Are you familiar with debate?
Yes!
Really?
Yes!
Okay, very good. So we will have this day. You want to tell something? Okay. So today we will have a debate on the applications of nuclear radiation in
Medicine.
Okay. I need 12 volunteers. So we have two groups. So in this group, this will be for the affirmative or for the proposition group. And then this group will be for the negative or the opposition group. Okay, so I need 12 volunteers who would like to join. Okay, so
There are countless areas where the power of radiation and nuclear techniques has been harnessed for the benefit of mankind, not only in medicine but also in industry, agriculture, and other fields of science and technology. The benefits to patients in terms of life saved through improved medical diagnosis and treatment techniques are countless, and the well-trained and controlled use of radiation has become key part of modern medical treatment, especially for certain forms of cancer. Today, medical imaging helps to detect and diagnose disease in its earliest stages. It enables physicians to determine the most appropriate and effective care, where previously exploratory surgery was necessary to discover the cause of symptoms or the nature of the disease. Patients today need not worry about hearing loss or nerve damage because the doses of chemotherapy they receive are much lower and just as effective. And besides, there are radiation safety such as shielding and containment, distance, and limiting time.
okay, thank you, Cecil. Now, how about from the negative side?
Something to keep in mind is that one must know the effect of radiation in our body before they undergo on using such applied nuclear radiation in medicine. It is important to know what the exam is, what it is for, and how the result is. This is important to what is needed for your medical purposes. We strictly disagree with the application of radiation in medicine because we do believe that radiation can cause death directly. Every one of us should know that there is no assurance in that process. Knowing that, this will help us to promote not to apply radiation in every matter that affects in our bodies human health. Radiation carries a large number of particles that causes a cancer. Keep in mind this. No level of radiation is perfectly safe. What do really save us, rather, is that the probability for one of these particles to cause cancer is very low. There is about a chance 1 in 30 quadrillion.
Okay, thank you. Next speaker.
Another advantages of the application of the nuclear radiation in medicine in terms of diagnosis is the radioimmunoassay or RI technique. This technique is used to detect the hepatitis virus from the blood samples. It also can be applied and in detecting the presence of drugs and a range of other substances from the blood samples of the patient's blood.
Okay.
Another bad effect of radiation is harmful in most circumstances. Relative strength of exposure plays a big factor in health, appearance, fertility, and bodily functioning. The effect of radiation may even be carried out in the next generation in some instances.
Another advantage of the application of the nuclear radiation in medicine is the treatment or therapy. Um, Radiation therapy is commonly used to treat cancer. In treating cancers, the purpose is to cause damage, particularly to the cancer cells. For example, is the iodine-131, in which it can use to treat thyroid cancer. Another is the gallium-67 and technetium-99, in which they serve as tracers and used to locate tumorous tissues. Another is the cobalt-60, in which it is used to kill.
And they can also encounter those side effects because you can't deny that the person undergo will be exposed on radiation because as what you have said, they applied on it.
Okay. Another question. Do you have any question? Opposition group? Mark? Already asked. How about you, CJ? Do you have?
Did you know Marie Curie, the scientist who conducted an experiment to radiation in his laboratory? That experiment was his severe death, so how can you say to us that radiation helps us to maintain the long life of human if it is the cause of death?
As I stated a while ago, it is not radiation that caused Marie Curie's death because she used radioactive isotopes put in his packet. She didn't use the radiation safety.
Okay. Any comment? Yes.
Marie Curie, a physicist, died on July 4, 1934 due to the aplastic anemia contract from exposure to radiation. And how did you know that Marie Curie did not die because of the radiation?
He's not died. She's not died in radiation. She's died in carelessness of handling radioactive materials.
But a physicist is always careless for himself because she make an experiment about what did. But Marie Curie died because of the exposure. Not he is a he is not she is not careless of what she was doing.
Do you think putting radioactive materials in pocket is not carelessness?
Okay. What can you say about that? Opposition group. Okay, James.
That's not the point that not really matters. What the matter is Marie Curie was died because of exposure on radiation, not on the isotope on her packet.
But isotopes is a kind of radiation. It is bad if we do not use radiation safety.
Okay. Another member from the affirmative group. Question. Erica?
How can you say that radiation is too dangerous if it helps us to make our life longer?
Okay. Can you repeat your question? Erica?
How can you say that radiation is too dangerous if it helps us to make our life longer?
If we do not prefer to use radiation, we can also apply that healthy lifestyle, proper way of living, and without radiation, we can live longer because we all know how to care ourselves, and if we apply, then in some cases, let's have an example. If I will ask sick person, I will never use radiation because this radiation can cause directly death directly, or if it is not death directly, there were side effects that we will get from that, even short term or long term. But how if I get long term? Can you say that radiation also helps even I have a lung cancer? Erika, what is your answer? Any member from the affirmative group?
Lung cancer can also treat by radiation.
But lung cancer produced by radiation. And the lung cancer are the most radiosensitive organ, and radiation pneumonitis can occur, leading to pulmonary insufficiency and 100% of death. Okay? Yes. There you are.
Additional, and did you know that many people who receive radiation therapy experience skin problems, dryness, itching, and blistering?
Okay, so affirmative group. Yes.
But as well as causing cancer, they can be used to kill off cancer cells and even cure people from this illness.
Are you satisfied with your answer? Opposition group? No. Okay. So, another idea. Affirmative group. So, the opposition group are not satisfied with your answer. So, how will you defend your side? Madonna.
According to the book that I have read, we can use the elements like cobalt-60, which it can treat what you have said, cancer, and um, it can kill cancers deep within the body. And iodine-131 can also help. Then another elements is gallium-67, technetium-99, in which it can cure tumorous tissues.
Okay. Used before some practices which radiation is not involved, they will not suffer from that disease.
Okay, last one question. So, both of you gave your ideas, concepts, and knowledge on how to handle radiation. So, we have what we call radiation safety. And this radiation safety help us to protect ourselves, our environment from the bad effect of radiation. Okay? So, congratulations to both of you. Job well done for this activity. Okay, let's clap our hands.